With childhood vaccination rates lower and cases of vaccine-preventable diseases like measles reaching record highs, the new school year is an important time for parents and caregivers to make sure their children are up to date on recommended vaccines. Now, as parents navigate conversations around childhood vaccines, access to credible information can help them make informed decisions about routine vaccinations. And joining us with more is Dr. Michelle Fiscus, a board-certified pediatrician and Chief Medical Officer for the Association of Immunization Managers. Good morning, Doctor. How are you?
Hi, Elliott. I'm great. Thanks for having me.
Well, we appreciate your time. Valuable information here. So, first of all, why is it important for children to be up to date on recommended vaccines before heading back to school?
Well, as you pointed out, we are seeing record cases of diseases like measles that we have not dealt with in decades because our vaccination rates have been so high. So before we send our kids back into a school environment where they're in a classroom with lots of kids all day, coughing and sneezing, we want to make sure that they're protected against those kinds of diseases. And we want to make sure that it's not our kid that takes those diseases to school, maybe to infect a pregnant teacher or maybe a classmate that has a compromised immune system.
Yeah, another question that parents may have, why are vaccines recommended at different ages throughout childhood, and why do some require more than one dose?
It's a complicated schedule for sure. And we time those vaccines at times where the child's immune system is best to be able to respond to those vaccines and create the kind of protective response that we want. And we also time them to make sure that children are protected at times when those diseases are most likely to cause the most damage. So, for example, we vaccinate against whooping cough or pertussis beginning at 2 months because it's kids under the age of 1 that are most likely to be hospitalized or even die from a serious case of whooping cough. And then we vaccinate adolescents against things like meningitis or human papillomavirus because they're at an age where they're most likely to be exposed to those kinds of germs. And then those extra doses of vaccines are to just remind the immune system, hey, this germ you've seen in this last shot we gave you, we're going to give you a little reminder of that now, so that when we do see these viruses or bacteria in our bodies, the immune system immediately recognizes that they need to be destroyed before they can really get in and cause serious harm.
Yeah, parents and caregivers have so much to think about and remember when it comes to back to school. So how do they find out which vaccines are recommended for their children and if they're covered by insurance?
Well, the good news there is that almost 100% of the time, these are covered without any out-of-pocket cost to parents. So whether you have commercial insurance, maybe through your job, or your child is covered under your state's Medicaid program, or even if your child doesn't have insurance at all, there are vaccines that are available to you at no cost, and that's provided through laws with the federal government. So parents can feel very comfortable that when vaccines are recommended to them, they are not going to have to pay to get their children protected. And the best place to find out if your child is in need of a vaccine is to call their healthcare provider. They should have those records. But if not, contact your local health department. They should be able to pull the records down from your state's immunization registry and tell you exactly what your child needs right now.
What should parents and caregivers expect before, during, and after their child's vaccination appointment, especially if their child has missed a recommended vaccine?
Well, I always caution parents not to tell the children there won't be any shots or that, oh, there'll only be one shot, because you really never know going into your provider what is going to be needed. So if you need to have a conversation with maybe an older child about getting shots, just tell them that, yes, there might be shots. They do hurt for a second and then it's over, and that they're really needed to keep them healthy. And then once you get to that appointment, you can do distraction techniques to help your child, play I Spy with them in the room, or just have a conversation with them so they look away from what's happening. If it's a smaller child, just give them extra cuddles or hold them while they're getting the shots to keep them comfortable. And then afterwards, the things that we most likely see are low-grade fever and maybe some redness or tenderness at the site of the shots. So you can put a cool compress there to help alleviate that. You can give a dose of Tylenol if you need to. Older children can get ibuprofen, but know that those symptoms are going to be gone in a day or two, and they are much, much less severe than what would happen if your child actually did get infected with one of these diseases.
Yeah, great information. I always find candy's a valuable tool as well. Dr. Fiscus, thank you so much for your time this morning. Truly appreciate you.
Thanks so much, Elliott.
It's a pleasure. Now, to find more information on childhood vaccines and all parents and caregivers should know ahead of the school year, just head to cveep.org.